some product has been approved, some product not approved.
Ah, okay.
Yeah, so if it's real glutathione, it's like vitamin C injection is approved. But then you need to check based on the regulation of its country itself.
Okay.
But it's true, glutathione can induce the brightening on the skin.
Okay.
But like how big is the dose, because you don't also want to destroy the kidney, right?
Of
Or the
course.
liver, right?
Okay.
So we need to be careful. I would not go into that direction.
So we are in the heart of Bali today on a very special podcast with a very special guest for this episode of Heart Life Rhythm with me, Dr. Jen. So we've got Dr. Saptania, who is a colleague of mine. She is a doctor, a physician. She's an aesthetic physician who is actually the director of an aesthetic clinic, and she specializes in various forms of treatment, including acne treatment as well as anti-aging, amongst others. Welcome to the podcast today, Wendy.
Jem. Hi,
So lovely to
nice.
have you.
Thank you.
So I think our audience will be interested to know that we first met each other about 15 or 16 years ago in Hong Kong, where we were doing a medical elective. So I was coming from the UK with a couple of friends to, you remember the name of the hospital? Queen Mary Hospital, which is a massive hospital in Hong Kong. And then we met you. You were coming from Germany where you were doing your NDDS.
Yes.
So you've had a long journey. I've been following your journey on social media. And now you've got a successful aesthetic clinic practice in Jakarta. What made you decide to do aesthetic medicine?
Actually, at the very first beginning, I was doing just a general medicine. But then my mother got a practice. She was a dermatologist, but now already retired. And then she asked me to follow up on the company.
Okay.
So then we started to start expanding the business. So then we opened several clinics in Jakarta doing aesthetic mainly. And then somehow, I kind of fall in love with the business.
You fell in love with that. And if I have to ask you the difference, because some people from different countries might not be familiar with aesthetic medicine.
Correct.
They might have heard about dermatology.
Correct.
What is the main difference between the two, or is it linked,
So basically, we are all doctor specialty combined together. Also, plastic surgeon doing aesthetic, dermatologist also doing aesthetic, and there's also aesthetician physician, which GP, but now taking some diploma course or some master degree or some other kind of workshop. They're doing now aesthetic, and it is something that is non-invasive. So if it's invasive, we would refer it to the surgeon, of course, plastic surgeon. Yeah.
Okay. So you all work closely as a team.
As a team, yes.
As a team. And at the moment in 2024, would you say you are treating the bulk of your patients or your clients are more men or women? And more, are they younger or older? What would you say?
Before, because it was before my mom's practice, there was one clinic, mainly all female, about 50 or something. They want to look better. They don't want to age. They want to look, because in the Indonesian society, because I'm in Indonesia now, so I just came back from Germany. But then they're all looking for more beautiful appearance, right? We're all in Asia. They want to do the hair, the face. They don't want to look old. They want to get rid of the wrinkle. And most of it, they don't like the sun. So,
that's something similar in a lot of Asian countries.
Yes, because we have a very high UV index, because we are just in the center. And then that's why they don't like the hyperpigmentation, which for like Caucasian, maybe it's cute, the freckles. We don't want it. And we want to get loose of it. And then also some female older one, they want to look better. So that's why they came to us. But then more often, they bring also the family with them. So also like small kids, also teenager, which is battling with acne. Yeah. So my first concern was, there was a patient of mine came because of the acne. She didn't want to go to school. Even she got depressed and she didn't want to meet the friend. But then I thought, aesthetic, you're just doing something like cosmetics. I didn't really take serious of it. But then after we tried to cure this lady, this person who already become older, and now she already visit college, So when she came back and then the acne already healed,
Yes.
and it became better. She already went out and then went to see friends. And I saw in her social media already taking pictures of her now. So I become happy, you know. It's just like something maybe all other doctors would think, oh, why you doing this? It's just cosmetic. It's like going to beauty salon. But it's not. If you help someone, you know, mental health issue also there. You know, some lady even they feel like they're old, they already looks maybe appearance not so good. They become like very quiet and you know just don't want to go out. Correct. And then it's kind of sad. But then if they turn out, you know, they feel better and then they go out in the society, they say, oh, you know what, doctor, thank you for making me look like this. Now I'm so happy. It's just also make us very happy, you know.
Absolutely. A lot of the confidence, I think, especially teenagers who are growing up, they're not quite understanding their body, the way their body is functioning, all the changes inside, outside, in the environment. And I think if you can add that bit of self-confidence, because the exterior, you know, at that age is extremely important, at any age, but at that age, as you said.
Correct.
So it is a very important job, I think, to make people feel good about themselves at the end of the day.
Some people just thought like, why are you doing fillers or Botox? That's all synthetic. You know, you're making a bad society. But it's also not, you know, if you can cure the acne, for example, just like that, even some teenagers, they go suicidal for that.
Gosh.
Yeah. So if you can maintain it and work together with maybe some psychiatrists also, and it is really helping.
Really helping. For teenagers who have really bad acne, what is the latest treatment that you have available that you can offer them?
Yeah. Actually, we need to give the oral antibiotics.
Okay.
Yeah. And then we need to do everything from the outside. Also, check everything on the inside also. It could be also the hormonal imbalance. It could be also what they're consuming. You know, nowadays people eat like not healthy food. And then maybe their sleep habit is also wrong. How their lifestyle, how they manage their stress. So it's a lot of things like happening at the same time. So it's not only what you see outside.
So you have to work on all of that.
Right.
In terms of food, is there any special food that can trigger acne?
Yes, of course. Because junk food mainly, a lot of preservative, and most of the people now consuming a lot of sugar.
Sugar.
Yes, sugar. And it's also not only sugar like you mentioned, candy, but everything, you know, this kind of sweet drinks. They like to drink nowadays in Asia, they like to drink boba, for example. It's a lot of sugar inside, a lot of these boba things we don't never
You
know.
mean like the bubble tea?
The bubbles, yeah, with a lot of I don't know what chemical.
It's very popular in the UK also.
And milk also inside. Some of the Asian people, they have the lactose intolerance. Most of it actually. When we can check in the blood whether they have it or not. But then it turned out they have lactose intolerance. I also have lactose intolerance. So yeah, maybe better to avoid cow's product, milk's product, right?
So it's a very in-depth, very deep work that you have to do with them.
Correct.
It's not looking at the surface. You're digging deep into the reason.
Yeah, and sugar also breaks down the collagen. So that's why you're looking old if you consume too much sugar. Yeah.
Sugar is bad.
Yeah. It's the culprit.
It's the culprit.
Yeah.
Great. I'm learning a lot of new things here. So I had a lot of questions in my mind, so I'm going to proceed. What are two other, apart from the acne, what is one or two other main problems that people usually come to you for?
Pigmentation. Hyperpigmentation, which is like occurring, could be anything. Could be from the sun, we call it the lentigo, like the small one, like a round one.
Yes.
Or we have it like melasma. This is happening for like female aging 45 and above. Sometimes also hormonal imbalance, including genetic factors. So they have this like a very like a patches.
Like a red patch?
Black. Black for all over the face. Also here on that area is like they have similar patches. And it's also genetic.
Genetic.
Yeah. And the bad one here in the developing country, we do have like this cream which is very dangerous. It contains mercury.
Mercury.
Yeah, it's illegal. Everywhere illegal. But somehow in this developing country, it's still around the market. Somehow they pack it nicely and say maybe it's something others, like maybe snail product or whatever, like a pearl cream, but it contains mercury. And if you use the mercury, then you get the ochronosis, we call it. So ochronosis happen after like long terms using of this kind of product, which is.
And this product, what exactly is it? Is it like a steroid cream or is it like a fairness? What is?
So they contain mercury. This like in the sea.
Yes,
they also
the
have like the
mercury.
mercury.
Yes, but what do people use that cream for?
Bleaching, for the bleaching.
Oh, it's a bleach.
Yeah. The second one is hydroquinone. The hydroquinone used for dermatologists to treat the pigmentation. It's okay if the dermatologist prescribe it, but nowadays people, they cheat you. They put in the cream nicely, like it's skincare. They put also steroid because the hydroquinone is photosensitive. So when you get the sun, it's got redness. So they put steroid to cover up and calm the redness. So after long time of the steroid using, you got this telangiectasia is like small blood vessels.
Yes,
so you see everywhere here in my country, a lot of people with a black patch and also these blood vessels.
Oh,
So they are all, because of that. Because they just want to look pretty, they bought the wrong cream. And they use it over time. And if they stop, become worse.
my God.
Because they already used to be fair and white. When they stop, and they become very like grayish, dark pigmentation. And it's very hard to cure.
Very hard to cure. I was going to ask you, what do you do about this? How do you help this?
I do laser, I do injections, skin boosters. I do maintain also giving oral antioxidants to do. But then it takes longer time, takes years by years to get rid of it. And it really causing psychological stress.
Of course, I can imagine. So that's one of the major problems. This antioxidant sounds very interesting. Or you said oral, so like pills.
So like glutathiones.
Glutathiones.
Or then some nowadays we do have the cysteine. It's from the white tomato. It's cysteine. From the white tomato because it has a high antioxidants level. Basically something like that for the skin.
And that can help also.
Yes, can help get rid of the pigmentation.
And you also have a lot of experience and expertise in anti-aging, which is everybody wants to look young forever. We don't really accept the fact that our body is going, undergoing a normal process in life. And I think, well, anyway, that's on the rise. What are the major developments in that field in terms of anti-aging?
I think people nowadays, they overdo it a lot, like they go to, let's say, Korea to do plastic surgery. It looks like, the dolls or something. That's not what I meant, because I'm not against plastic surgery. Of course you can do, but for me, plastic surgery should be something like correcting, not changing you. You should be you, just make it a bit, nicer. You 10 years ago, maybe it's already dropped the eyelid, then you correct the eyelid, it's not changing you into other people. That's why my this field for me is non-invasive, so I don't change. I just make you look better. So maybe we can put some other, like, it's not fillers. There are so many other things other than fillers. We can do with the machine, with the device. Let's shape you, or then a little bit of tox there or tox here. But some people is again Botox. So I will say botulinum toxin because I will not say the brand, right? But it's common around here because it's simple procedure, not dangerous, and then it like treating the dynamic wrinkles. So you just loosen a bit of the expression. But then if you do too much, you look scary, right? You look angry.
Yes, because sometimes, and that's unfortunate. I think most people end up looking better, but sometimes you see those scary, as you said, photos of celebrities. You don't recognize them anymore, unfortunately.
I would say there is no bad product. It's just the bad doctor maybe injecting,
And by dynamic wrinkles, you mean wherever you've like laughter lines,
right?
Like,
and then it becomes permanent because you always like maybe like we think a lot. So we think a lot. We're doctors thinking a lot. and then we do like this.
Like a frown.
Yeah, and then become already permanent. Then you can avoid, because not everyone should get the Botox, because some people, they get more like activity of the dynamic muscle is more strong. Some people don't. You know, some people like my friends, maybe they don't use a lot of this, which I always concerned, and I do a lot of this activity.
Okay.
Yeah. In Asia, the trend now is putting the jaw like very small. They like the V-shaped one. So they do the tox here in the masseter area. Masseter is the muscle around this area, jaw. So when you weaken that area, then you become like slender, like slim.
So they want like a sharp chin?
Yes,
Like a sharp
very
jawline.
female one. Yeah.
Even men want
No,
that?
men don't want that.
for
I
women.
got some men asking for it, but it's a different purpose, right?
Okay.
Yeah.
And how long does that procedure take?
The procedure takes only 10 minutes. Yeah, it's very simple.
Okay.
But then it takes around 4 months, then the activity will be back. It will be back to normal, not even worsen, yeah. Yeah, because I had on my face last time, but then I stopped for like 2 years because I wanted to see how it goes. But then I forgot how to frown, so I think it's good, you know.
It's fine,
Yeah, it's not becoming bad, you know.
So that treatment you said for the sharpening, it's not permanent.
No, after 4 months, you'll be normal again, come back, become big again, the muscle. But this muscle is also important, because if you chew a lot of steak, then you hit this.
Yeah, I was going to say that. Oh, okay, very interesting. Is there a particular, apart from the shop, is there anything else that the people in Asia that you treat, or even from foreigners? I'm sure you must have a lot of medical tourism that people are looking for now as a new trend that, you know, I want to look like this, or
the trend now is to look like a very like a filter, you know, like an Instagram filter Paris, you know. You don't want any pores, you don't want anything on your face, you know, which is impossible to do because you're a human. Then you have the pores, right? So they like this kind of glass skin treatment. The trend is from Korea, because all this flawless lady you see in the Korean drama, right? So nowadays, even you see, if you go to the malls, before I saw like the models blonde, you know. Nowadays, I saw like all the Korean artists, Korean singer, right? So it becomes like very deep influence, even for men also. They want to look like that. The men now asking also to look like fabulous, you know, no pores, which is, for me, is a bit, you know, a lot of social media, already, inside. So they're looking for a glass skin treatment. Mostly they doing the surfacing laser, and they do the injection, which is salmon DNA. So this salmon DNA,
Salmon DNA.
yes, it's salmon, real from salmon. Yeah. So they took the DNA from the salmon, from the testis, from the sperm. Yes, but the sperm from the testis is called polynucleotide. The one that already out is PDRN, polydeoxy. So it's different thing. It's two, PN and PDRN. PN is the most like concentrated one. They have a long chain of protein. No, sorry, cut. The PN is the long chain one. Long chain and less longer. The PDRN is the one that more like, let's say, fluidy, using more for cosmetics, right? So they have in the cream, the skincare, you use that one.
That's the
PDRN. It's more the short chain one. The PN is more concentrated one, the long chain one. But they already remove all the protein. So you don't have any allergic reaction.
Yes, I was going to ask you.
Because I have also a lot of patient which is vegan. They don't want any protein on their product. So actually they just call it salmon DNA. They took the DNA, which is the DNA happened to be, when we back learn in the school, right? The adenosine, and then, you know, this change. There is no protein, so there is no immune like sensitivity against it. So let's say you have allergy for a fish allergy, so you don't get allergy with this product. The product you can inject, or you use it as a skincare. Yeah.
The injection is more effective?
Of course, because it's more concentrated. It's the PN, basically.
So that, what does it do? It tightens your skin?
So it just makes your DNA better. So makes your skin cells better. Inducing the fibroblasts for the collagen.
Yes.
Right? And if you have inflammation, like for acne, for example, you have inflammation. The one that I said before, because of the mercury and everything, steroid overuse, you have inflammation. Anything in your age, you have inflammation because your bad food and everything, your sleep habit, then you can reduce this inflammation by giving this polynucleotide or PDRN injecting or as a skincare. Skincare is more superficial. Injection is more deep. Yeah. So you correct the balance on the skin. So you make it healthier. That's it.
Interesting.
Most of the injection they're doing like they put you like a brightening thing. It's just for temporary. But this one is more like for long term. It's just making your skin healthy.
How many injections would you be looking to
3
have?
times every month apart. But then you just maintain. After that, maybe 4 to 6 months one time. And if you don't do, it's no problem. It's not like your skin getting bad. It's just getting bad because you keep aging, right?
Yes.
1 year older, 1 year older. So you just hold a good condition of your skin. And this thing has been controversial, you know. In Asia, Australia, they've been using. In US, still like, you know, pending. They already have the product.
They have the FDA approval,
but only for
the topical.
They comes in so they do come in injection. But then the registration is topical applying. You do micro needling. So it's like giving like small micro holes, and then you put topical on it. So I think the regulation is different.
So would you say for cosmetics and aesthetic, who are the leaders in terms of countries? You mentioned Korea already a few times. Is that the leading in terms of, you know, number of procedures or the advancement, the technology? Or does it
I would say the technology for the laser, most of the laser, I still would stick to the old company. You know, they already been researching for a long time, publication already out for maybe 15, 20 years. I would stick to the Europe and US. But then after a while, this late like five years behind, Korea kept like, you know, investing and then inventing a lot of things, also device and injection. So the salmon DNA basically produced in Korea. Because from the river there, so they caught the salmon from that river in Korea. They were the lead producer, and then everybody else just buy the, you know, the basic things as a polynucleotide and then put in a syringe. But they are the one that produce the polynucleotide. So it's like they are the leader for this kind of field. That's why it needs to be approval in everywhere in the world. But for some device like laser, the technology has been around like for, let's say, in US for a longer time. So then it depends if it's device or injection. And apart from the salmon DNA, there's also many other injection. Basically, hyaluronic acid. And now collagen stimulator is in.
A collagen
Stimulator. Now it's the era of the collagen stimulator.
Tell us about that.
So collagen stimulator is anything other than the hyaluronic acid that you inject into the dermis of the skin. So this layer, right? So you put some strange thing, we say, like they call it PDLLA or calcium hydroxyapatite. There's a synthetic there already research, you know. And then they put in the dermis, and then the collagen will start to look, oh, there is new thing here. Okay, let's attack. So they build another one, collagen.
So it is to stimulate collagen production.
Fibroblasts,
Are there any side effects?
Of course, if you don't place it properly, then it causes a granuloma. So you'll see some nodules on the skin, then you'll have to remove it by surgery. So we don't want it. So that's why depends on the practitioner if you want to go that area or not. But nowadays, the emerging is not filler anymore. Not hyaluronic acid anymore. The filler becoming like calcium hydroxyapatite or the collagen stimulator becoming now the trend. So if you go to Korea, amazing. There's a lot of things, you know, like you do in like one day, 5, 6, 7 procedures. You come back, you know, like totally
like a different person.
Nice skin,
nice
right?
skin.
But then how many times you can afford to go there, right?
Why is it that Korea, and to some extent when we went Hong Kong also, people very conscious about their skin? Why is it those countries, do you think, have... I don't know if it's more or it's just our impression is that they maybe invest more in that when you're all these types of treatment.
I think it's subjective for my part. I think it's the government. The government put a lot of money to, let's say, a doctor, they train to be plastic surgeon. They train to be aesthetic cosmetician. You know, they put a lot of pressure on that. They put the, like, the Korean drama,
Yes.
they invest a lot in everything, right? So,
And
I
the
think,
K-pop culture
right?
also, they're all very slim, all the
Very
singers, and
skinny.
skin is
And even
perfect.
it's not enough for the woman. They know the market is also men, right? So they want to go into men's market. Now they also, showing you the men which is look like a doll and everything. So I think it's kind of, influencing in that way. So men also spending money on aesthetics.
Yes, they are.
Yeah.
They are.
I think it's the
Very
government. So they
interesting.
try to take a lot of money into the country. You arrive in that airport, you see plastic surgery
Yes.
advertisement.
There's another question I wanted to ask you. So I'm from, obviously, I've got Indian roots, and whenever we used to grow up, not so much in my family, but friends, there's a very high, very strong emphasis on, the skin needs to be fair, white complexion and all of that, selling fairness creams, not staying under the sun, using home remedies to look fairer. Is that something that you have seen or that you get a demand for in Indonesia also?
Yeah, especially Indonesia, Southeast Asia country,
So,
right?
yes,
They
yes.
have we have a lot of people like different kind of skin from
Okay.
that skin type 4 until 6.
Mhm.
So we have also Indian,
Mhm.
we have also Malay, we have also people from Papua which look like African. So it's basically huge market here.
Okay.
So we don't know like where to start. So if you say like we always want something that we don't have, right?
Yes.
Yeah. So in Jakarta, it's like capital city. Some girls also, came as my patient and they say like, okay, I still want to look tan because I pay expensive price to look tan like this. So don't remove.
Okay.
They say, but if you want to do laser for like this glass skin treatment for the pores, it automatically going to be brightening on your skin. But then they say it like, yeah, but I don't want to look bright. I still want to look tan. Please don't remove my tan. So it's kind of hard, to differentiate because it's lifestyle. You always want what you don't have.
Absolutely.
Right? The grass is greener on the other side.
Absolutely. So in the UK and the US, it's always standing bed still and
Right.
UV and whatnot to
Right.
make your skin look
Yeah.
darker.
Like my neighbor is like a customer of mine said like, oh, what did you do to my husband? He looks so fair now. He's Indian, right? So I was so happy. And then she came also to the clinic. And then the next one is the mother. The next one is the other friends. So I have a lot of Indian customers actually
And that's
in my
with
neighborhood.
and that's with the laser treatment?
With the laser only,
or
nothing
with the
injection.
laser?
Yeah, just the laser. We do the pico laser.
Pico laser.
Yeah, now if you say about pico laser, it's also like if you Google pico laser, a lot of things coming up.
Really?
Yeah.
Can you tell us a few
Right.
things about
Yeah.
that?
So the Salmon DNA, right? So
Yes.
it's trend. Pico laser was already trend before.
Okay.
So pico laser using a very like a big of energy of the laser and doing in a very short way. So like say like if you do like you punch people, right?
Yes.
You don't punch people. I know. But if you punch you punch slowly and long, or you just do like the
Okay.
damage is different. So
Okay.
this high like
Intensity.
intensity of this machine and how delicate is the machine, who is the production, who is the producer of the machine, it depends, the manufacturer, sorry, who is the manufacturer of the machine, it's different. So how you deliver the result is different.
Okay.
From any pico machine is not the same. There's so many pico laser brand in the aesthetic
In the
world right now. So we need to choose which one is for more safety, more like study case. We need a good publication. We have to research first.
And again, do people, would they need several treatments or is it the one?
But even with the one treatment, you
One
can see the
treatment.
result with the pico laser. It gives you like brightening of the skin, small pores, induce the collagen also. By saying induce collagen means no wrinkles.
I see.
So this one machine can do basically almost all, but it cannot go deep to the muscle, cannot go deep to the fat. So you still, sometimes if people saying, oh yeah, I have a sagging jaw, maybe with pico it correct a bit on the superficial way, but then on the inside you need a lift, right? So it's maybe might need some other device, like for example HIFU. HIFU is very trendy in Korea.
HIFU?
Yes, high intensity focus ultrasound.
Okay.
So it goes deeper to your mesh layer above your muscle. So it tighten up. It gives you like a wound inside, but you don't see from outside. You see nothing happen on you, but after a month, the wound inside will induce the wound healing and the new collagen. Then it becomes like shaping.
I see.
And it can also destroy the fat. So must be careful because some people they don't want to lose the fat, but some people with double chin they want to lose the fat. Yeah,
very interesting.
very interesting.
That is, I'm learning so much. I'm sure the audience as well. I had a question which kind of slipped my mind. So in India, we hear a lot, of these Bollywood stars. We don't know if it's true or false, having glutathione, I think, injections for skin whitening.
Yeah.
Is that something that's also used here? Or not so much?
Depends. Some product has been approved, some product not approved.
Okay.
Yeah, so if it's real glutathione, it's like vitamin C injection is approved. But then you need to check based on the regulation of its country itself.
Okay.
But it's true glutathione can induce the brightening on the skin.
Okay.
But like how big is the dose, because you don't also want to destroy the kidney, right?
Of
or the
course.
liver, right?
Okay.
So we need to be careful. I would not go into that direction.
So you think
Because-
laser would be safer?
But then you cannot all laser all your body, right? Let's say I have a patient. She's a golfer, and then she came to me say, "I want to look bright." I say, "Why you want to look bright?" Yeah, because I want to look pretty. But you're a golfer. You be needing this, this protection for the sun.
yes.
Then you have to have the tan, right? So it's more safe for your skin. You don't get skin cancer. Why you want to be brightened? So I wouldn't recommend to do this kind of glutathione injections because she needs a protection on her skin because she's a golfer. It depends. If you're a housewife that never goes out, only inside the house, then maybe you can do that. But if not, then I think it's not necessary. So I think we need to educate the people, like why would you look like the people in the social media,
Because presumably what you're saying is that the vitamin C or the big doses or the glutathione, it blocks or it reduces the melanin production.
Correct.
Is that
Correct. Yeah. So it blocks the melanin production.
Okay. So for you, the laser would probably,
if you want to remove some freckles, some
yes.
pigmentation, okay. But if you want to look bright, it's just on the face and neck. But if you want to look like the whole body is white, I mean, like what's first the purpose,
Yeah,
if it's
exactly.
unhealthy for you, maybe we shouldn't do at all.
Absolutely.
Yeah. If it's for the health, for like immune system, okay, I will do the vitamin C injection. But other than that, put a lot of things, it will be also side effect on the
Yes.
system,
Yes.
liver or kidney, anything. Yeah.
And from the treatments you've mentioned, the Salmon DNA, the pico laser, all of that, are they safe in special populations, like, for example, pregnant women? Or
I wouldn't touch any
you
pregnant
wouldn't
women,
touch?
yeah, because they've been asking also. I said,
Yes, yes.
okay, maybe after like you finish the
Yes.
lactation, even
Yes.
for the lactation, I wouldn't do. Yeah.
In case it crosses the...
Right? Yeah. So because like Botox or something, we wouldn't do because it's a toxin, right? It's a small
Yes,
particles.
of course.
So we would never know. So I would wait until the lactation finish. But if she's not doing lactation, yeah, then not breastfeeding, I mean,
Yes.
then we can do.
Then
Yeah.
you can do.
Yeah.
Okay. Another problem I have, I've realized, I've noticed everywhere is people are losing a lot of hair, men and women.
Yes.
I don't know if it's nutrition, diet, stress. I don't know what it is, but people are losing hair and younger also. Is that a population that you also treat?
Yes.
What are your thoughts on that?
Yes. We are also doing hair loss treatment. We are a chain clinic. So we also have the dermatologist doing the hair treatment. And we have the machine, we have the injection, we have the medication. So most of the people, normally if you say they're aging, it's normal. Suppose you're aging, you lose a bit of hair, right? But then some people, like teenagers also came to me with a problem of hair loss. Then it's not normal. It must be something in the hormonal which is not correct. The mother kept buying her, like say, hair products. It's not working. Then I should advise her to check on the thyroid hormones. Yeah, and then she got a problem with the thyroid. She got better, so the thyroid, the endocrinologist correct the thyroid. Then she got back the hair. So It's not my field of treatment, right? Expertise. But then if let's say a lady, 50 years old, or even not 50 years old, perimenopause goes now 45, right?
Yes.
Losing hair, and then I can do some treatment, just to avoid, just to delay. But then if she's seeking more than that, maybe should go to the other like hair transplant, surgeon, then they can do take the part, behind part, and do the hair transplant over on that area. Because as we age, it's normal to be, losing the
Yes.
hair. And it's also genetic, don't forget.
Genetic.
Yeah.
These genes. And I've heard hair transplant is painful.
It's painful because you need to take all the follicles one by one from the behind part. First, you take the a slice of that, and then take one by one the follicle and implant it to the, let's say, the front one that's losing. So they put the front one and one by one, and then after that you have to maintain, because otherwise you can lose the hair again. Then they will be required to do PRP injection, plasma rich therapy.
Really?
Yes.
You mean the transplanted hair can fall off?
Yes, it can. So they ask people to take drugs, so finasteride, or do the PRP. Not or, and or, yeah, both. Doing both again to maintain.
To maintain.
Yeah.
Gosh, okay. So it's not a one-off that you'll
It's
be
not a
treated
one-time
and then.
thing. Yeah.
Wow.
Yeah. So basically what I do, I don't do the hair transplant, the surgeon will do. So I will do in my clinic, we do like nowadays many things, like the thulium laser. So the thulium laser will create small holes.
Thulium?
Thulium laser.
Okay.
So the laser based with thulium, like the energy base, because laser has many energy.
Okay.
So thulium is doing like a small holes in the skin of the hair scalp. Then we can put the serum. The serum is a growth factor for the hair.
Okay.
Or we can inject them, instead of with machine, but it's painful. So some people, they do avoid pain. So they're doing injection with the PRP. So we take our blood, we draw the blood, and then we work on it, and then separate. So I only take the white blood cells or the plasma, but the good condition one, then injecting it back to the hair loss area. Some people, they also have only like alopecia areata, so it's only the round, behind. It can also caused by stress, right? Some people do get the hair back totally normal, because if reduce the stress and then get the hair treatment. Yeah, but different than the androgenic one. The androgenic alopecia is more like when you get older, your hormone decline, right? It's like your estrogen decline,
Yes.
testosterone
It's like the male
decline.
baldness pattern, right?
Correct. And it's also genetic always play around. Yeah.
And so, do you think eating, for instance, more protein would help?
Biotin and selenium, I would advise.
Biotin.
Yeah, biotin, selen, zinc. They do have in a multivitamin dose for the hair nail support. Normally they have like biotin, selenium, all kind of vitamins. Then you should take it. If you feel like you're having the hair loss now, you should take the supplement, because anything that you eat, how many can you eat?
Exactly.
The supplement is very simple. Yeah, you should maintain from now. Take the supplement.
And what about vegetarian diets and skin and hair? What would you say to the vegetarians?
Vegetarian, you can eat the tofu. Then we have very nice tempeh, Indonesian local
You do
tempeh.
fresh.
Oh, it's so good, I can eat every day.
Yeah.
Then you should seek for the vegetables, vegetable option of protein.
Yes.
How to say?
Yeah, vegetarian.
Vegetarian option proteins. There's a lot. In my country, it's very easy to get, because we have all kind of the good, tofu.
I have to say, the milk is also like the soya milk.
Yeah, we have the soy. From the soy, you can create anything. I mean, like, it's easy here. Yeah. Just you check on you can draw the blood and then check in the lab which of the supplement or which of the vitamin you should, replace. Because otherwise you cannot eat, like, let's say, I don't know how, one big pack of carrots,
It's impossible.
Yeah, it's impossible. That's why it's just you check which one, because there is something, it's a part of this, but it's also in the anti-aging we do. You check the blood, you send you draw the saliva.
Okay.
So you send the genetic to Canada.
Okay.
Yeah? But nowadays we can also do in Indonesia already.
Okay.
There are already lab doing. So you check the genetics, and you can see in this kind of person which deficiency will be. which micronutrients will be. Let's say for me, it's the vitamin D. So anything I do, let's say I take, I don't know how many glass of milk, I wouldn't get, it's
not
cheese,
sufficient.
Yeah, correct. So it's only gonna be sufficient. So in my genetics, so I have to take the supplement, the vitamin D, soft gels.
So that thing, just taking a sample of saliva and it analyzes what, your DNA?
Yeah, there's a saliva one and there's a blood one.
And a
So
blood
there's
one.
two. You check the genetics. You can see in the genetic of these people, or this genetic of these people, oh, they need the supplement substitution, for which one, like biotin or the vitamin D or the which one.
And what is this test called?
Genetic test.
Just called,
so
yes.
I wouldn't say the brand.
Oh, you
because I
cannot
don't
say
know if it's
it's just a
commercial.
genetic test.
Yeah, it's
We won't use any
Yeah,
commercial.
everywhere in every lab. So in Indonesia now they can do it. Before we sending it to Canada, yeah, they have this program sent to the lab in Canada, work together with one company in Indonesia. But nowadays the lab in Indonesia already can do it. So I'm sure in everywhere in the world the lab can do.
it.
It's called a genetic test.
Okay.
For like anything.
For deficiency.
Yeah, for deficiency.
What about weight loss?
This is a very important part, right? Because you look pretty, let's say you do your face, you do the laser, you do the lessons, Salmon DNA, but then you walk like 70 years old. People will just notice you, anything you do, facelift, but then you're not healthy, you're like obese, right? So it comes back to you and your body. So I think the exercise is number one. Any supplement you take never be the same if you do exercise correctly. And then, the food that you maintain, your eating habit, must be the number two for me. Exercise, number two, food habit.
And you had said avoid sugar.
Yeah, and also a choice of food. Yeah, some people also choosing like like a fatty diet, something like that. They just don't maintain a lot of carbs. Just keeping in the. You have to count like you're a hardworking one. You need the physical activity, or you need more protein. Is there something you have to maintain, like how many calorie diet a day? I never count, but then if I already get full, I stop. Some people have difficulty in the brain, the right?
Yeah.
So the transmitter,
leptin and
leptin. So that's why, so some people need help. Some people like this, it's not they are conscious of it, so they just cannot stop.
The appetite center is not suppressed, basically.
So I think they need to look for the professional for it. But I'm saying it's the normal society, right? So you go to restaurant, you've been served the food, it's already inside so many fat, so many salt, like MSG. You don't know what's inside, right? So you have to avoid maybe going to the healthy way of living.
What about Indonesian, the old cultural remedies or home remedies or way of living? Is there anything in the culture that promotes, healthy skin, healthy nails, healthy hair that you know of, or that your grandma maybe used
We
to?
do have and we still use. Yeah, we have this, we call it jamu. So jamu is traditional remedies. So we press, nowadays, before they use with hands, right? It's a lot of work. Then your hand become yellow because it's like curcuma, right?
Okay.
We do have curcuma, ginger, everything. We already have this remedy. We've been doing and we're still doing. So like every morning, for me would be like I press the red beet, carrots, tomato, celery. Now I already not using because I got a low blood pressure out of the celery. It's very good for the high blood pressure. Apple, like the green apple, not the sweet one. Then I press them together with the curcuma. Yeah. Then I press, so it's only the water. Then I take it as a herbal remedy for
your
me every
morning
day.
cleansing.
Yeah, every day. But now in Bali, I don't have my
yes, of course.
so I asked them to make for me, but it's a lot of sugar. They put like.
I've seen the jamu drinks here. It is quite sweet.
Yeah, but they put a lot of sugar there. Yeah.
They've got different ones with the.
And they have what? They have one with rice. They make fermented rice. Yeah, and they make it healthy out of it. We have so many remedies. Yeah.
Interesting.
Yeah.
And how do you see that the future of aesthetic medicine is going? We're shifting towards what? Do you think, for instance, that artificial intelligence,
Yes,
AI, is
they
going to help?
mentioned to me. Yeah, they mentioned to me they're using now AI in
Okay.
every device. They manage, the machine to like doing the AI to know what kind of treatment is suitable for this kind of person. But then it will be shifting, right? We normally we just use the eye of the doctor, the hand of the doctor, to check, and then we give the diagnose, we give the treatment plan. Now the AI will be doing all of this, so I'm not really sure how it's going to be, but the future is going to be AI. They
You think
already
it's going to
mentioned.
be
And some mission came from comes from US, no, from UK company,
yeah.
already using AI inside. Yeah, I just came back and then I saw some machine device. They're already using the AI.
But it's fully AI, so you don't need a human doctor.
That's my
Or
concern because they
yeah.
said you can, anyone can do, any beauty therapist, just put like this, then you leave it with the machine, the patient. That's why I was like, oh, so what I'm going to do then?
But also, as you said, there's questions about if there are complications, can the machine deal with it? Because a therapist
Correct.
dealing with a machine
Correct.
is not trained, is not a trained doctor like you are.
Yeah.
And there's a lot of ethical, I think,
Yeah.
things that will have to be monitored
Yeah.
before that.
But the
I don't know
future,
any-
it will be like you dealing with the machine. They leave you in one box, then they'll do everything.
Or maybe having the machine delivered to your house in
Oh, it's
future.
even possible.
I don't know. I don't.
Possible, they already have this LED, right? The LED mask, like
Yes.
they all putting. Before they
Yes.
used to come to clinic for the LED. Now they're buying and use.
Gosh.
And the micro needling, they also have now in the skincare.
Really
They
at
put small,
home?
small needles, yeah.
Oh.
Did you hear about
No,
it?
I don't
Korea
know.
already inventing. So skincare with a needle inside. So it's a small, small particle of needles.
Okay.
They give you like the same treatment like a micro needling in the office.
Huh. My gosh.
Yeah.
Okay.
But back again, complication can occur.
Yeah, no, I think
Yeah.
people will have to think carefully before embarking on that. We're nearly reaching the end of that podcast. Was one of the most exciting podcasts. I've learned a lot. I think we'll have to do a
Still so
volume
many
2
things.
at some point, I'm sure. Maybe online in future.
I think you should come to the clinic and
Maybe
see your own. And
I think maybe I will. Maybe we will. I had one last tiny question. This is called Heart Life Rhythm podcast. So I would like to ask you, Wendy, what is one thing that you love about this country, Indonesia, or about Bali even, and one thing that you love about your job?
it's difficult because a lot of things to say.
Too many things.
But
you can say as many.
Yeah,
as
like
you
I
wish.
think Indonesian is like, they're already winning because of the beautiful
Yes.
country.
Yes.
Or
Gorgeous
you see,
country.
gorgeous on the
Beautiful
beach,
country.
and the people are so friendly.
Absolutely.
Anywhere in the world, I think they're always like friendly people. Sometimes they talk too much, of course.
No, not at all.
Yeah, but they try the best to help you with accommodate a lot of things. It's just they're developing, It's still developing.
But developing quite quickly. As you said, beautiful country. We've only been here for 5 days. First time in Bali here.
I hope you enjoy.
I love it. The sea is a bit similar to us
Yeah,
in Mauritius.
beautiful.
You've got beautiful, beautiful beaches and lovely temples.
Yeah.
But the main, I think, for us is the people.
Yeah,
People's
the people,
hearts.
people
Really,
heart.
people are very polite, very sweet, very knowledgeable about their
Yeah.
culture. They want to share. And they're very open, very cheerful people, good energy. So we've really, really enjoyed it here.
I'm happy to hear.
So thank you again for coming on the podcast. And we'll definitely have to do part 2.
Sure.
So thank you.
Thank you.
Thank you.